Forge 103.9, a new sound. This is Real Talk, and we have a special guest in the building, don't we, Andres?
The return of Dr. Meave from Clinica Sierra Vista, the Chief Medical Officer there. How you doing?
Good. Thank you for having me.
So I know that I didn't get to meet you last time. My colleagues here, Bob and Matt, got to meet you last time. So very good to meet you. But tell us, how have things been, in the medical world? It looks like the pandemic is starting to slow down a little bit. We should still be vigilant, but are you experiencing it differently?
Well, for us, it's been busy.
But
that's good. We like busy. We like to take care of patients, and we like to get them tested and seen and taken care of and vaccinated. Mm-hmm. So, yeah, we're happy that the numbers are slowly trending down, the COVID numbers. Mm-hmm. But for us, it means more business.
Okay.
That's good.
So a lot of folks getting vaccinated. Or are we seeing increases in vaccination?
I think it plateaued for a little bit, but now that the boosters are out and approved, we're seeing all those patients coming back and getting their third dose, their boosters.
I'm ready for mine.
And yeah, good.
Yeah, me too. I'm ready for my booster. I can't wait. I'm trying to figure out how I can get one.
And since the CDC approved the vaccines for 5 to 11, so now we're really, really looking forward to calling all those patients and get them ready and vaccinated so that they're ready for Christmas.
Yeah, I remember a doctor was out there with us for. We were out in the fields doing the stuff.
For
the
quadrilla. We're La Quadrilla giving information to all the farm workers and the field workers out there, all those great people, essential workers. What was the response to when you guys go out there and talk to the field workers?
They didn't have as many questions as I thought. The majority of them were already in the process of getting vaccinated or getting the second shot. So I was really, really happy about that.
Excellent.
Yes.
So as Chief Medical Officer, I'm sure you're in charge of all the medical affairs of the organization.
Yes.
Y'all are the largest federally qualified health clinic in the country. Is that correct?
Not of the country, but we're up there.
We're up there. Okay, one of the largest.
We're the second biggest in California.
Oh, wow. Okay.
Yes.
Okay. For some reason, I thought y'all were the largest in the country. So
not yet.
Not yet. I like
coming.
that. See?
It's coming.
So are you seeing patients and stuff like that, or is your work a little different?
I do. I don't see patients every day. I have a lot of admin duties, and then I have to go to Fresno every so often, and do things over there. But I still have my panel of patients, and I still go to clinic once or twice a week, and I do in-person and virtual visits.
Do you miss being in the clinic every single day?
I do. I do. Sometimes it's nice to have a desk job, but I do miss my patients, and I think they miss me. And then if I don't stick with my appointments, they get upset.
Yeah,
and I like that.
I bet. Well, let's just cut to the chase here. We've been very excited to have you on. It's been 2 weeks now since we received an angry call from a listener, and I'm going to let Bob just kind of fill you in a little bit on what we had to deal with a couple weeks ago.
Yeah, I can't say it any better than this person can. She called in and raised hell here.
I think angry is kind of putting it lightly, but we'll let you all decide.
And talk for a few hours. But at the end of the day, if people want to do the damn bunker, they should. If they want to
yelling at us isn't going to get it.
Hold on, ma'am. Hold on, ma'am. Hold on.
If you're listening, you think so much is going on. So
what's going on? So let's take y'all back.
Let's backtrack.
And Dr. Meave, we filled you in on this a little bit, but let's tell the listeners. So in San Francisco County, In-N-Out decided that they weren't going to allow for they weren't going to enforce vaccine and vaccine kind
proof
of
of vaccine.
Yeah, proof of vaccine
for
laws.
indoor dining.
For indoor dining, they said no, it's not our job to do that, right? And so the San Francisco County Public Health Department went and shut them down. The next day, the city of Tehachapi here in Kern County, our neighbor, where I grew up at, where I went to grade school and high school at, said, "Hey, Tehachapi, hey, In-N-Out, you have a place here." In Tehachapi, where we will gladly accept you. You can serve cheeseburgers as you wish, and you can even serve with the side of freedom.
Just how I like it.
Just how people like their cheeseburgers, with the side of freedom, right?
Yeah.
And so we decided to have some fun with that segment. We had a lot of fun with it. But for some reason, an anti-vaxxer thought that we were talking about the vaccine, which we didn't mention besides the fact that they're asking for vaccine cards.
Proof of vaccine.
But
that was it.
She began to accuse us of spreading misinformation. Said we're no different than any of the media. And then she had some choice words for us. She says that we don't know what we're talking about.
Let me play it on this. Let me play it.
Let them play it.
How you create immunity. But I feel like I'm talking to a 2-year-old. You don't know
And then she hung up, right? And you should see Dr. Meave's, she's going, oh my, who is this person, right? I will add, she did call and say she works at a medical office. A little scary, especially some of the claims. And so what we wanted to do is we have some parts of her conversation that we want to break down. But since we're a bunch of 2-year-olds, and we don't know crap,
bleep,
we don't know bleep,
bleep.
We don't know bleep. We decided to bring in the experts. So Dr. Meave, are you ready to get into some of this stuff? You heard the whole call. What did you think of it? And then we'll get into the specifics.
Shocked. A lot of anger there.
A lot of anger, and she works at a medical office.
Yeah.
And they even had a doctor call back and say that
trying to get us in trouble, to be honest.
I know.
She went straight to management. Like,
what is kind of the general sentiment of people in your field towards doctors who are saying, "Oh, the COVID-19 vaccine doesn't work"? Are they kind of seem as quacks, or like kind of what are people thinking about these folks?
Well, I don't want to put words out there. I want to be very careful with the words that I use.
We'll say it for you.
Not 100% of the clinicians or people that work in healthcare are in agreement of the need and the benefits of vaccines, but that doesn't alter the facts.
That's a good way to put it.
Yes. So the majority, thankfully, the vast majority of healthcare workers, understand the need, have a great respect for science, and obey the mandate. So, they continue in healthcare in the state of California and in many other states that are also enforcing a mandate. But it's not unanimous. It's not 100%. And it's sad.
You know, my dad used to tell me all the time. He said, numbers don't lie, but liars figure.
But liars
figure, right? Yeah. And kind of what you said, right? It's like, the facts are the facts.
Yeah.
Right? And so some of these doctors, you're right. Numbers aren't lying, but liars figure.
Yeah, I'm curious. When a doctor goes to get licensed, you're obviously supposed to, like, you go through all your schooling, you learn about vaccines and all that stuff. I mean, you take an oath and all these things supposed to be. I mean, not a doctor at all, not an authority, any sort of medical training, anything like that. And how could you get licensed to be to practice medicine? And vaccines are obviously a part of your thing as a doctor, and you're just telling people, hey, well, my doctor said no, vaccines are bad. Wouldn't you go tell the people go tell the medical board, say, hey, the doctor just said no vaccines. Shouldn't their license be taken away?
Well, every state has a different process, but I guess when we go back to the basics, and the main goal for a physician or a clinician is do no harm. Mm-hmm. So if you're spreading misinformation or just things that you believe or things that you read on Google or that your friends tell you, that is a harm. Mm-hmm. That is harming patients. The core of our profession is based on science, and numbers don't lie. I agree with your dad, 100%.
Man, I just love the way you're putting things. They're just so kind, but just some sharp comments. You know what I mean? Like, much better than we could. And this is why we brought in Dr. Meave, right? Because
absolutely.
We sound like a bunch of 2-year-olds.
Yeah,
up
we
here.
definitely do.
But we brought in the experts, and do not turn that.
Hey,
dial.
I played Operation.
Yeah.
I played that.
But do not turn that dial, because when we get back, we're going to play some parts of the person's call where she kind of makes some outlandish claims, and Dr. Meave here is she's gonna set the record straight, and she's gonna let us know about the facts. You're listening to Real Talk on Forge 103.9, a new sound.
Forge 103.9, a new sound. We are back with Dr. Meave, who's the the Chief Medical Officer of Clinica Sierra Vista. Sorry about that. I was
one of the biggest health clinics in the country.
One of the biggest, and
right here in our backyard.
Yeah. Exactly.
Soon to be the biggest.
She's here to talk to us about some anti-vax claims that we heard from a caller a couple weeks ago. So
she was a little angry, right, Bob?
She was a little angry.
Let's play it one more time, just so people see how angry she was.
And talk for a few hours. But at the end of the day, if people want to see the damn bunker, they should. If they want.
I think that's enough.
That's enough of it. I think we got the point. But one of the things that she got into, Bob, was that she started to make some claims, right? And one of the first claims that she made was in referencing autism and vaccines. Mm-hmm. And Dr. Meave, you probably have heard, this has probably been something that throughout your education and your training, people have kind of talked about, but have denounced it for the most part.
Yes. So we're all very familiar with, patients that come or anti-vaxxers, claiming the association between autism and vaccines. And there is absolutely no evidence that there is an association. As a matter of fact, that's not even my area of expertise, but I'm not a pediatrician, but I do see kids because I'm a family medicine provider. And I can tell you that, there's no research out there. There's no trial. There's nothing that associates those two. Autism is actually, the classification of it recently changed, and now it's a spectrum. There's an autism is spectrum disorder. So there's different variations within, and none of them has anything to do with vaccines at all. So that's completely false.
So, Dr. Meave, we're gonna play some of the audio of some of the claims that she gets into, and then we'll talk about it.
They have linked autism to vaccinations for many, many years. When I used to Google it back in the day, it was all over. Now, you don't really find it on the internet since this whole COVID thing has started. Okay, they have linked it to autism. In certain countries, they have even banned vaccinations for children. Okay, a vaccination recycles itself every 100 years. No one gets the chickenpox anymore or the measles. Why do we keep injecting the bacteria from those viruses in our children? And if there's a chance it's causing autism, then that's a chance maybe we shouldn't take, right?
You know what's my favorite thing? She's all like, they took it down.
And there's a lot to unpack there. So we're going to work our way through this. But the first question I have for you is Google kind of a medical journal?
No, it's not.
Oh, okay. Because based on what she said, I would have thought Google was.
Remember WebMD?
Yeah.
My life's over. Just found I got a week to live. I looked it up on WebMD.
So you saw one of her claims is that there's you never see you Google vaccines autism and then they've taken it's disappeared. Matt responded and said, well, maybe because it's not true, right? But has it been known for organizations to go and for organizations to go down and take down misinformation that could cause harm?
I hope. Yeah, I seriously, I'm actually glad if she did look at that up on Google and it's no longer there. I applaud Google for taking it down. Yeah. That's actually their responsibility, to stop the spread of misinformation. So maybe she did read it and it's no longer there, and that's good. But what I can tell you is that it's completely false. And I personally don't know of any country that banned vaccines. We certainly have never done that. That's like one of the greatest achievements of medicine ever. Yeah. So I'm actually very proud to be practicing medicine and living in a country that enforces vaccination the way we do here in the United States. And it's just such an honor to be part of a country that not just vaccinates their population, but also, gives millions of vaccines to other countries in need. Just because it's just the right thing to do. Because we're all in this together. Yeah. As cliche as it sounds, it really. True.
And they talk about public health, right? Part of public health is making sure that I'm taking care of myself, so the person to the right and left of me are okay, right?
Exactly.
And me not being vaccinated, I could spread measles or chickenpox or all these other things, and we've seen how quick that spreads. And we're going to get into that chickenpox and measles conversation later because there's a whole lot to unpack there as well.
Oh, yes.
But, the other question I have for you is where did some of these kind of autism vaccine link claims, do you know when they started to originate and how they've grown to life? And maybe I'm asking you how did conspiracy theories start? But is there any insight that you kind of have?
Before you do that, the first time I ever saw it was when Jenny McCarthy, who was with Jim Carrey, she's a celebrity. Mm-hmm. She's the one that was the first time that I ever really started hearing it. And celebrities, they're on social networking, and it just spread. Boom.
Actually, it was Jim Carrey.
It was Jim Carrey?
Yep. And doing my research for Bob's Bonehead of the Week, Jim Carrey was a big anti-vaxxer in the early 2000s and big vaccines called autism.
Oh, wow. I didn't know that.
Yeah. But as we were going back to what the kind of the origins of that kind of,
and I think it's it's just easy to pinpoint something when there's no real definitive answer for something. So people speculate, and yes, if someone that is out there in the media on TV sharing maybe personal information or their opinion, that spreads. It's very powerful. So we have to be very, very cautious on what we say and the impact that we have on others. So it's just an opportunity to do the right thing and communicate what is right and not spread all this misinformation.
Oh, it's all over the place right now with the COVID vaccine.
Yeah.
I mean, lots of celebrities. Oh,
Yeah. Well, you know,
oh boy.
what's interesting is they've nailed on the COVID vaccine. They said there's 12 individuals. They call them the something dozen. New York Times did a big story on it. 12 individuals who spread 70% of the COVID-19 misinformation that is seen all over the what's it called, social media. 12 people.
Wow.
Have an impact on that much of the world.
I read that. I was reading that story.
How embarrassing.
Yeah.
That's a top 12 you don't want to be a part of, right?
You know what's tough is that one of them is related to somebody whose family is very prominent in the United States and is very liberal. That's Robert F. Kennedy Jr.
Yes.
And you know what's funny is I didn't realize he was an anti-vax. I actually met him a few years back, and I was taking pictures with his son. And I was just thinking, like, man, like his son probably, if he didn't vaccinate him, like I probably could have got measles or something else from his son, right? We didn't know this until very very recently. Did this idea of vaccines and autism ever really have any real life in the medical community, or was it kind of immediately shot down after just like initial research?
I mean, there was research because you need to show proof that it's true. It's not true, but aside from that, that's it. There's really like nothing that
There's like no link.
There's no link.
And do we know what causes autism?
No, we don't. It can be multifactorial. So that's why it's like a diagnosis of exclusion. You rule out every other possibility, and then you really have to observe the patient and follow the patient, and you have to meet certain requirements to have the patient qualified for the spectrum.
You said something of exclusion. What was that again?
Diagnosis of exclusion. And that's not the only one. We do that. We have a lot of those in medicine. I don't just diagnose anybody with like, oh, you have amyloidosis. It's like, no, based on your symptoms, I have to rule out this, and that. And, if none of those are present, then I will diagnose you with amyloidosis, like, for example. That's it. It's
so so autism isn't the only thing that we will use the process of exclusion on. There's plenty of other medical.
Oh, lots of them.
Lots of it. Okay.
Lots of them, and that's not the only misconception or things. Misinformation that is spread from anti-vax. Like it's also based on the culture of the patient. Some patients associate vaccines or are scared of vaccines because they think they're associated with problems conceiving, problems getting pregnant, and like that they're not going to be fertile anymore. And that's absolutely not true. Like it has nothing to do. Like there's proof of that. Vaccines have nothing to do with like hormone or development of certain organs. So yeah. Yeah,
but we're just barely getting into the first part of the conversation here. So when we get back, we're gonna have some more questions with you regarding measles, chickenpox. You make some claims like, why would you why do we keep doing these vaccines? So we're gonna ask you that question. Why do we keep doing these vaccines? Do not turn that dial. You're listening to Real Talk on Forge 103.9, a new sound.
Forge 103.9, a new sound. This is Real Talk. We are back with the Chief Medical Officer of Clinica Sierra Vista, Dr. Meave. And you know what, Doctor? You've given us a lot of information about, this anti-vax callers. I don't know. I guess you would say opinion, right? Because none of it's factual.
Anger.
Rhetoric. But Andres, you were talking about like chickenpox and measles. And
so she said in there like why people don't get chickenpox and measles anymore, which isn't true. People still get it.
Look up measles Disneyland. There you go. Boom.
Look up measles New York City public schools.
Exactly.
I'm going to Disneyland in like 2 weeks. Is there something I don't know about that I should look up?
I think they've Lysoled it all down. Man, I don't know.
The question she asked is, why are we injecting parts of these vaccines like chickenpox and measles if they've essentially been eradicated? And can you answer that as to why we continue to inoculate people to fight off these these diseases.
So it's good that she acknowledges that we don't see these diseases as often anymore, and that is because of vaccines. It's the only reason behind that. Viruses are very strong. They continue to mutate, but fortunately, these vaccines continue to be very, very effective. But to give you an example, I think everybody associates measles outbreaks with Disneyland, but there was a very large one that happened.
And the new Netflix show, You. Have you seen You?
I started watching
it.
The
guy gets measles from an anti-vaxxer.
But there was an outbreak that was studied heavily, and this was in Pennsylvania, and it was an Amish community that they're against vaccines, and we were able to well, not me, but the scientists were able to really look at the data, examine the population, and they noticed that because the number of people that live in that community drop, the vaccine status of those patients dropped below 82%, there was an outbreak. So that tells you how virulent these viruses are and how important it is to push for vaccinations and make sure the vast majority of us are vaccinated so that we don't have these outbreaks. So that's a very, very high percentage. Like, you really need to have more than 82% of your patients or your population vaccinated to avoid outbreaks.
Have you ever seen cases of the measles?
I have.
And what about chickenpox?
Yes, I actually had chickenpox.
I have. Have you guys had them?
I've never had chickenpox.
I don't know. See, and I believe I was vaccinated against it, but somebody was asking, like, you do not want to get chickenpox when you get older.
So you're saying that the doctor and I are from the old world, or what?
I mean,
oh man, I just aged myself here.
I mean, Dr. Meave, isn't that kind of why, like, the vaccines, we get them young, right? Because our immune systems don't have the instructions on how to beat these viruses, right?
That is
correct. And that's why we get them, and that's why they don't
Yeah.
exist anymore.
Yes, and because we do it in small increments, a lot of these vaccines are 3 doses or 5 doses, and we get them after, like, within certain interval during childhood. Now, I grew up in Mexico, so I was not vaccinated for chickenpox. That was not mandated in Mexico back in the day, not too long ago.
Yeah, not too long ago.
Is it, you know if it's mandated now?
It is.
That's
Oh,
good,
wow.
because
It
their
is.
president was kind of like weird on COVID for a little bit there in Mexico. He could have been a lot better.
Absolutely.
I think everybody had high hope for him, and he hasn't lived up to any of
he
it.
totally dropped the ball there.
That's a different story. It was interesting because she mentions why inject these viruses into people's bodies. I think there's a clear distinction with the COVID-19 vaccines, though, right? There's actually none of the virus in at least the Pfizer and Moderna vaccines. We're not actually injecting the virus into our bodies like that of a flu shot
No,
or
not.
other types of vaccines, correct?
These are not live vaccines. There's just a handful of live vaccines out there. And COVID vaccine is definitely not one of them. It's just a fragment of a messenger RNA from the virus that we inject. So we're not injecting any DNA from anybody. We're not injecting like fetus portions of anything.
It's pretty disgusting.
None of that.
Yeah. And that, it's interesting you mentioned the fetus thing, because I know in the Latino community, one of the big reasons why people were against it was because they're very Catholic. It's a very Catholic community. And people were saying, hey, we don't want to be using the fetuses of anything. And even the Catholic Church was kind of weak on it. They didn't come out right away. But since then, they've been a lot stronger.
And now for the Catholic community, like the Pope continues to endorse vaccines. And I'm glad he's doing that.
Yeah.
Yeah.
It's really weird that as skeptical as anti-vaxxers are, all somebody needs to say is, but this is what they don't want you to know for them to believe everything. This is what they don't want you to know. Oh, well, then tell me everything I need to know now. And then, so, Dr. Giggles comes on some YouTube video and just gives you all this misinformation. No, don't listen to Dr. Giggles on YouTube.
So
that's my favorite Sunday, programming. Dr. Giggles on YouTube, right?
We have one more segment coming up, but I think we've learned some important things today here, Matt, right, and Bob. Is one. Yes, we still see cases of the measles, and we still see cases of the chickenpox, and that's why it's important to be vaccinated against them. You explained what there in Pennsylvania with the Amish community, when it dropped below 82%, they began to see more outbreaks, right? So there's science and there's data to back up these claims of vaccines working. The second thing that we've heard today is that there's no link between vaccines and autism, and we don't really know where autism comes from.
That is correct.
And so two of the claims that this lady seemed so convinced about, was what, they were proven wrong. And so we have
proven false.
Proven false. So we have one more segment with Dr. Meave here, and the next one's a little bit more touchy. It talks about pregnancy and vaccines. So you don't want to turn on dial if you have any questions about it. We're going to be talking with Dr. Meave here on Forge 103.9, a new sound.
Forge 103.9, a new sound. This is Real Talk, and we are back with our last segment with Dr. Meave, who's the Chief Medical Officer for Clinica Sierra Vista, and she's coming on talking to us about a caller called in a couple weeks ago with some anti-vax claims, right? And we're all pretty pro-vax here.
Yes, we are.
So we just decided to bring on the experts.
Pro-fax.
Pro-vax, right?
Pro-vax.
And she had a very touchy part of her call, didn't she, Andres?
Yeah, and the reason why this one kind of made my ears perk up is I have a sister who's pregnant, Dr. Meave. She's due in February. We're very excited. It's going to be the first niece in our family, my parents' first grandkid. Very excited. Right away when the vaccine was available, my sister did know that she was pregnant, and the doctor said, go ahead and get the vaccine. Actually, we had one of your colleagues here. I can't remember her name right now.
Dr. Franco.
Dr. Franco. Yeah, Dr.
Mm-hmm.
Franco was on, and she was pregnant at the time.
Yes,
and
she was.
And she said she got her vaccine, and she seems to be doing okay. My sister got her vaccine months back. She's been, she's pregnant. She's been fine. But this lady shared a story of somebody who received a vaccine and didn't have, I shouldn't say didn't have a good experience, but is claiming that because she received her vaccine, that she didn't have a good experience. So, Bob, if you can cue up that audio. Again, this is a little bit more graphic, folks, so just be mindful of that. But again, we're trying to get down to the facts here, and that's why we have the experts in here, not 2-year-olds.
Listen, my friend who's pregnant just gave birth and got her vaccination 3 months being pregnant. A week later, she bled for 3 months straight. Now her baby has a missing chin, the heart's destroyed, the legs are deformed, and she's a nurse, and she said, there's something that told me not to get it done. Number one, they have not even approved it for pregnant women, but pregnant women are doing it all over the place.
So there's a lot there, right? Where do you want to start, Dr. Meave?
I want to start by saying that she's wrong. The vaccine has the emergency use authorization for anybody, basically any adult, including pregnant patients. And it's actually endorsed by ACOG, the College of Obstetricians and Gynecologists. And there's a big push for it because of its benefits.
Yeah.
Mm-hmm. And I also saw some things that came out, like one of the things that we've instituted since my sister has been pregnant is if there's going to be family get-togethers, if you're not vaccinated, you can't come.
Yeah.
Mm-hmm.
Because we have a couple cousins.
Yeah.
Who are just being.
Don't we all? Don't we all?
Anyway, we all, but one of the things is that we saw that women who are not vaccinated, the chances of birth complications, the chances of the baby not making out of it alive, if the patient gets or if the
COVID,
pregnant gets COVID, there's just kind of everything just kind of increases, right? And so that's why we've instituted that rule. So it's been approved. She makes these claims about bleeding after getting the vaccine. Is there even a way to tell if that's the case? 1 week seems almost too soon because they're saying that it takes 2 weeks for the vaccine to kick in, right? But I don't know.
I think just assuming that it was a vaccine, it's just kind of comical at this point. I mean, obviously, it's sad that her friend is experiencing this situation.
Sure.
My heart goes to her and her family, and I hope everything is okay. But I have never heard of anybody bleeding for 3 weeks after getting a COVID vaccine and delivering a baby. I have not heard of any clinical trials or any information from the CDC or FDA or anything like that with similar cases. Now, we are in close communication. Anybody that administers a vaccine, we're in weekly, bi-weekly, sometimes daily meetings with the authorities, with the county, with the state, with the CDC, with all these updates. And the moment that there is, evidence, proof that there is an association with something, we are the first ones to know, and that is communicated to the public. So that
it happened with Johnson & Johnson, right?
Exactly. Yes, there's been cases, obviously, that's been very, very public, as it should be, because there's, we should be all about transparency because we're based in science and data. So we want the data to come up and everybody have access to it. Now, in medicine, nothing is 100%. Nothing. You can trip and fall and have a brain bleed. You can, take a medication and have a brain bleed. You can have hypertension and have a brain bleed. There's many, many reasons why someone can have, complications, pregnancy complications. Now, if she's talking about, like a malformation, we got to go back to the first trimester of the pregnancy. And I don't know at what point she got vaccinated. Like, there's a lot of information that, points that need to be connected for her to be saying anything that could even be remotely close to a relationship with that.
That's pretty intense. The way she described like the state of the baby and then the bleeding and everything, that's pretty intense. One of the band members in my band, his fiance, she got vaccinated while she was pregnant. Baby came out super healthy, beautiful, happy, everything's fine. They're all vaccinated. The parents both got their boosters. Everything's fine.
Yes.
That's why when you hear stories like that, it's very disturbing. It's very sad. But I'm just, if the person who called was just kind of blurring out of emotion because she was so upset.
And the way she talked about her friend and her
I don't want to
like,
say maybe she was making it up, but we just don't know. Like, it was such an intense call. Like, you're just kind of like, I don't even know if this is real. That is this person, do they really mean all this? Because they can only take it so far. But I'm like, stranger things have happened these days.
And I think I think you guys are right. And if this was the case, like Dr. Meave said, our heart goes out to the person who had down to go. Nobody ever wants that with anybody,
not.
right? But to sit here and kind of, and I think she thought she was on the radio, right? And so that's really dangerous information because if there could have been a pregnant person listening, and that's why I'm glad we have Dr. Meave here on to let us know that. Hey, look at, if there is birth defects, have we ever known them to be linked to any vaccines or what is there things that we can pinpoint birth defects to?
No, not that I'm aware of. Of course, there are, many reasons why anybody can have a malformation. It can be nothing. You can have a malformation not associated to anything. It's just a defect when your chromosomes are like pairing and there's nothing we can do about it really. So it's very inappropriate to just make that statement. And yes, you're right. If she would have been on the radio, and someone would have listened, that it could have changed their minds, and that's misinformation, and that's what we want to avoid. And when the vaccine came out, this is new. Like it's something that a lot of people in the United States have never seen. They've never gone through this process of developing a vaccine, and they've been trying to develop like HIV vaccine for decades, and they haven't been successful. But this is something like it's a novel thing for a lot of people. So nobody can be making these statements like out there. It's just very irresponsible. And I think the way we're pushing for a vaccine or promoting it as we get data is the right way to do it. At first it was just, for adults and, proceed with caution with special populations, and then we endorse it. And now we really, really push for it because we've seen, we follow the data, and we've seen that there's no negative outcomes. So, this is just the right thing to do.
It's really, it's not funny, but what's kind of funny about this is people are going to say, oh, I'm sure there's going to be some people listening. They'll say, oh, well, Dr. Meave doesn't know what he's talking about. But Dr. Meave, we believe you know what you're talking about, and so we appreciate you coming on today. We couldn't have put it any better, and we wanted to make sure that we brought in the experts, right? Somebody who's trained in this field, somebody who's been responsible for vaccinating thousands and thousands of people throughout our community. We appreciate all the good work you all do to make sure that folks are being vaccinated and staying safe. Is there anything else that you want to add before we wrap up today's conversation?
No, I just want to thank you guys for inviting me and for giving me the opportunity to share what I have a responsibility to do as an oath that I have, as a physician. I encourage people to educate themselves, get information from the right sources, get vaccinated, and ask the questions, and get their kids vaccinated as well. And if you're pregnant, get vaccinated as well. I know of many colleagues and friends and co-workers who have gotten vaccinated, and thankfully they're all doing really well, and their families are too.
And be careful. We're heading into the holidays, Thanksgiving and Christmas.
Exactly.
Yes, folks, be extremely
And I'm
careful.
not seeing people who aren't vaccinated. I'm telling you that much right now.
Yeah, I try to be very careful about that as well.
You know what? Thank you, Dr. Meave. We appreciate you so much. This has been a great conversation. You're listening to Real Talk on Forge 103.9, a new sound.